Hi everyone, this is Dr. C, the NP, and today we're going to go over some rhythm interpretation, just going over some basic rhythms in a stepwise fashion. Alright, so we're going to go over 7 steps. First, we're going to look at, is the rhythm regular or irregular? Then we're going to look at, what is the rate? Then we're going to look at, what is the P wave doing? And then, what is the PR interval? And then, how does a QRX complex look? What is the morphology or the duration? And is there anything different with the T wave? And are there any ectopic beats? So if you take these 7 steps and apply it to each rhythm, it's really going to help you in your rhythm analysis. So let's look at our first rhythm here. Is this rhythm regular or irregular? So we're going to look at these QRSs. This looks like a regular rhythm. Now, is the rate within the normal range of 60 to 100? Or is it above 100 or below 100? This looks to me like it's within the normal range of 60 to 100. We're going to look at the P waves. We got P waves before every QRS. And our PR interval here, it's normal. So we're looking at it to be between 0.12 seconds and 0.20 seconds, about 3 to 5 boxes. And the QRS, that looks like a normal morphology, and then we've got T waves here coming after every QRS, and they appear to be normal. This rhythm does not have any ectopic beats, so this rhythm is a normal sinus rhythm. Moving on to our next rhythm. Here we have a rhythm. It looks like there's some regularity in this rhythm here, but we have some irregularity here. It slows down a little bit. Also slows down a little bit on this end as well. And then the rate does appear to be normal. It's a little bit of a longer strip, but this does appear to be within the normal range of 60 to 100. We do have P waves here before every QRS. And then the PR interval, if you look here, this is also normal before every QRS. Our QRSs all look to be a normal morphology. T waves, normal after every QRS, no ectopic beats. This one can be a little bit confusing, but it is a sinus arrhythmia. Why? Because it is normal here. We've got P waves, QRS, T waves, normal rhythm, normal rate. That's why it is a sinus arrhythmia. All right, moving on to our next rhythm here. We're going to look at the rhythm. Is this regular or irregular? So this one looks to be irregular. So specifically, irregularly irregular, okay? The rate looks to be a little bit tachycardic, so above 100 beats per minute. I can't really see any P waves, so I can't measure PR interval. We've got our QRS. Does look a little bit different. Can't really discern a lot of T waves here. I don't really see any ectopic beats. This is an atrial fibrillation, so irregularly irregular. All right, moving on to our next strip here. We've got our QRS. Our rhythm is regular. Does appear to be tachycardic above 100 beats per minute. We've got our P waves, and they do come before every QRS. Our PR intervals do appear to be normal. QRS is normal. Our T waves are normal. No ectopic beats. This is a sinus tachycardia. All right, this one here. So this is a regular rhythm. If you look at the QRSs, rate bradycardic. Now let's look at our P waves here. Our P waves are kind of all over the place. We've got P wave, P wave, P wave, P wave, P wave, P wave. There's no correlation of the P wave with the QRS. The P waves are just doing their own thing. QRS is doing their own thing. So no correlation. Can't measure the PR interval. Our QRS, a little bit wide, but otherwise looks okay. Can't really see our T waves. No ectopic beats. So this is a 3rd degree block. Key to the 3rd degree block, P waves and the QRS are not talking to one another, okay? So let's look at this one. We've got a regular rhythm here. If you look at these QRSs, rate appears to be within the normal range, 60 to 100. We can see some P waves here. It's a little bit difficult to tell. Our QRS is here. Looks okay. T waves, that's our problem right in here. We've got a ST elevation all along here and all along here. This is an ST elevation MI. All right, looking at this next rhythm. Looking here at the QRS, we've got a regular rhythm. It does look to be below our normal range of 60, so it's bradycardic. We've got P waves. They come before every QRS. We've got a normal PR interval here. It's less than 3 to 5, or it's within the range of 3 to 5 boxes. Our QRS is normal. T waves normal, no ectopic beats. This is a sinus bradycardia. Now let's look at this rhythm here. QRS, QRS, QRS. So it looks to be irregular, but these two seem to be regular, and it looks like there's something missing here. Now let's look at our P waves. We've got P wave, P wave, P wave, P wave, P wave, P wave. Let's look at our PR interval. So this is normal here, normal here. So it looks like what's happening here is we're just dropping this QRS right here. Right? So it's just dropping a QRS. So it would be regular otherwise. It didn't drop that QRS. We've got normal T wave here. No ectopic beats. This is a second degree AV block, type 2. Okay, so a type 2 second degree AV block. Alright, let's look at this next rhythm. We're going to look at these QRSs. This appears to be regular, but when we look down here at our P waves down here, this does appear to be somewhat of a tachycardic rate, just looking at the P waves. Can't really tell a PR interval because there's so many P waves. Our QRSs are normal, can't really make out a T wave, no ectopic beats. Kind of has a sawtooth pattern, that's atrial flutter. Let's look at our next rhythm here. Looking at our QRSs, we've got a regular rhythm. Maybe a little bit bradycardic, under our 60 beats per minute. Let's look here at our P waves. We've got P waves before every QRS. Looking at our PR interval, it does appear to be prolonged, okay, so above our 3 to 5 little blocks. Okay, QRSs are normal, T waves are normal, no ectopic beats. This is a first degree AV block, so that's prolonged PR interval, okay. Alright, let's look here. We've got a regular rhythm, with the exception of this right here. Rate appears to be normal. We've got our P waves before every QRS. PR intervals normal. QRS normal. T waves are okay. And here's our ectopic beat. That's a PVC. Alright, so here we don't have anything to evaluate. There's nothing there. So that's asystole. Alright, looking here. Let's look at our QRSs. A little bit abnormal here. Let's look at our P wave, P wave, P wave. What's going on here? It looks like our PR interval here getting longer, and then we drop a QRS here, right? P wave, P wave, P wave. QRS is normal, T wave is normal, no ectopic beats. So this is a second degree AV block type 1, also known as Wenke block, okay? So type 1 second degree AV block, type 1. So what happens here? We've got our P wave, which gets longer. The PR interval gets longer, 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 then we drop the QRS, Wenke block. Alright, so we're going to look at this rhythm. So, first thing, let's look up here. Person has no pulse, okay? So that's all really you need to know. It doesn't matter what it says here. This rhythm is going to be PEA, pulseless electrical activity, okay? That means electrical activity is going on, okay? Meaning that things are showing up on the EKG, but it's not actually happening because it's not being distributed. So looking here, this is a regular rate. However, the rate is very fast. It's tachycardic. Can't really see any P waves, can't measure PR intervals. Our QRS is wide. Can't really discern any T waves or ectopic beats. This is ventricular tachycardia. All right, let's look at this one. You can't really tell it's irregular. The rate appears to be fast. Can't really tell P waves, PR intervals. There's not really a QRS to be seen or T waves. This is ventricular fibrillation. The heart is just fibrillating, meaning shaking. All right, let's look here. We've got a regular rate here, and we've got a regular rhythm. You can't really tell the P waves or the intervals. QRS looks okay, can't really tell the T wave, but you've got all of this junk in here. That's artifact. Could be from a lot of different things. Somebody brushing their teeth, or the leads are on wrong, or something like that. All right, let's look here. We've got, looking at here, a little bit irregular here. Looks regular otherwise. Rate appears to be normal. Looking here at our PR interval, this appears to be normal. Something's going on right here. We've got our QRS, which looks normal. T waves are normal. Now what's going on right here? There's like a little ectopic beat here. That is a PAC. Okay, the PVC is a big thing, but a PAC is a very, very small thing. All right, we're going to look here. Let's look at our QRSs. QRS, all normal. Okay, going across. Regular rhythm, rate, tachycardic, P waves. Can't really see them, can't really measure PR intervals. QRS, tiny, normal. T waves, can't really tell them, no ectopic beats. Supraventricular tachycardia, SVT. All right, let's look here. Is this regular? Let's look. Yes, it's regular. A little bradycardic here. P waves. Can't really tell. Can't really tell the PR intervals. QRS is a little wide here. We've got our T wave here. It's a little bit wide. No real ST elevation though. And then we've got these spikes here. That's a paced rhythm. Those are pacer spikes. All right, we're on to our last one. All right, regular. I don't know about that. Is it rate? Looks tachycardic. Can't really tell P waves or intervals. Everything's very just wide. It's kind of going, it's getting wide, and it's getting small, and it's getting wide, and it's getting small. So this is torsades de pointe. So hopefully these steps are going to help you interpret some basic EKG rhythms. So utilize these steps, try to figure out what is what. This is been Dr. C, the NP, and hope to talk to everyone soon.